Welcome to some important insights into selected medicines for koalas. The Veterinary Pharmacology Unit at the Sydney School of Veterinary Science at the University of Sydney has been researching medicines for koalas and other Australian wildlife species for the last 15 years. This short video is to summarise some of our findings about the veterinary antibiotic Convenia when administered to koalas and other Australian wildlife species. Convenia is the trade name of this antibiotic. The more scientific name is cefovecin. Convenia belongs to a class of medicines known as the cephalosporin antibiotics. There are many different cephalosporins. Many of them are registered to treat infections in people, but Convenia is only registered for administration to dogs and cats. Also, Convenia is only available as an injectable formulation. Convenia kills many, but not all bacterial species. Convenia can kill most gram-positive, aerobic and anaerobic bacteria, and some, but not all, gram-negative aerobic bacteria. Key bacterial species that Convenia will not kill include methicillin-resistant staphylococci, and it will not kill the bacterial species Chlamydia pecorum that causes the awful disease of chlamydiosis in koalas. However, sick or injured koalas can be infected with other bacterial species, such as methicillin-susceptible staphylococci and Escherichia coli, better known as E. coli, and Convenia will treat these infections. So why am I drawing attention to Convenia for the treatment of infections in wildlife? Convenia is an antibiotic that is injected into cats or dogs, and a single injection has a duration of action for at least 10 days. In 2007, when Convenia first came onto the Australian veterinary market, specifically to treat skin infections or infections in urine, it was thought that as it has a duration of action for at least 10 days, it would be great to use in other animals such as wildlife species. And this is because wildlife species are generally not used to being handled. Rather than being repeatedly handled for daily treatment, a once-only injection would greatly reduce the need to handle the patient and would minimise their stress. There are a couple of reasons why Convenia actively kills bacteria for a long duration in a dog and cat. Once injected, Convenia is absorbed into the blood. Once in the blood, 95% of it binds to the canine or feline proteins in the blood. These proteins are known as plasma proteins. When Convenia binds to the plasma proteins, it travels in this medicine protein complex around the blood. But it is only the unbound form, the form that is not bound to the plasma proteins, that is active and is free to kill the bacteria. Also, some of the Convenia in the urine is reabsorbed across the kidney cell walls back into the circulation, and this replenishes some of the Convenia in the blood. So the key to Convenia's long duration of action in the cat and the dog is due to this high binding to the plasma proteins and then being slowly released and some reabsorption by the kidney. Because of this assumed property of a long duration of action, Convenia was being administered to many different species. After a while, when infections were not responding to the treatment, veterinarians started to consider that Convenia may not bind as much to the plasma proteins of other species. At this point, I would like to acknowledge and thank my previous PhD student, Dr. Soraya Garibi, who undertook the following studies. Soraya checked the amount of binding of Convenia to the plasma proteins in a variety of species. First, she looked at the amount of Convenia binding to horse plasma proteins, which was about 93%. and she checked that this result was consistent with other published studies that were investigating the same thing. She did this to check that her method was accurate and reliable and that her results were similar to those of other researchers. She also looked at the amount of convenia bound to the plasma proteins from some Australian wildlife species, and she found that the average proportion binding to koala plasma proteins was approximately 13%. She also found that there was 17% binding for the Tasmanian devil, 22% for the eastern grey kangaroo, 27% for the common brush-tailed possum, 35% for the eastern ringed-tailed possum, and 36% for the red kangaroo. Soraya also designed a study to administer convenia as a single subcutaneous injection at the recommended dose of 8 milligrams per kilogram to 6 koalas at Taronga Zoo. Soraya measured the convenia concentration in the koala's blood and found that the duration of effect to kill susceptible bacteria was not more than 6 to 8 hours. The key point is that a single injection of convenia does not have the same 10-day duration in the koala that it has in the cat and the dog. Convenia has been used in veterinary practice for many years, and now there are many other published studies that have shown that convenia has a short duration of action in many other species. So our conclusions are that convenia can be used as a broad-spectrum antibiotic in the koala and likely other wildlife species, but will require daily injections to be effective in killing susceptible bacterial species. We are so grateful to all the veterinarians and wildlife carers treating koalas with so much care and to the highest standards. We hope these insights into some medicines for koalas can be useful when treating them.